Hey everyone, in this video I am showing you a quick treatment of tear trough dermal filler. So this patient in the past has always had her cheeks done. Pretty much like once a year we touch up her cheek, do a little bit of a high G prime filler to give her some volume. And because of that, her under eye honestly has always looked pretty good, but the darkness and just that little bit of volume loss in that area is what's bothering her. So I'm going in with a really light filler that is just going to help hydrate the area and just kind of give it a little bit of volume without being overkill. So tear troughs are very tricky because we like to move very slow when we do tear troughs. So typically I tell patients when I treat them during the first appointment, they usually leave kind of feeling underfilled because you never want to do too much from the get-go. Under eyes can become overfilled very quickly, and then you never want to have to go in and dissolve and start over and have any of that lumpy, bumpy filler sitting in there. It kind of looks like a little worm of filler sitting under the eye. We never want that to happen. So I tend to move very slow when I do tear trough filler and kind of see the patient back for multiple appointments to make sure that it doesn't get overfilled too quickly. So as you can see, the very first thing I did was just numb her up. So I numbed with local lidocaine to ensure that she was comfortable when I went in with my needle and created my pilot hole. And then I am using a cannula, and the cannula is a Comfortox 25 gauge by 50 millimeter length cannula. And I love these for the under eye region because as you can see, it kind of fits all the way to the corner of the eye, the inner canthus. And then now I'm kind of going towards like the outer canthus of the eye. It's very comfortable for the patient. It doesn't require any kind of topical numbing or anything like that, which is really nice. I literally just numbed where I went in with the needle, and the rest of this is just going straight in with the filler. There is lidocaine in the filler, which helps keep the patient comfortable, but as you can see, she's tolerating it really well, and, is pretty pain-free. I like to do this area with cannula because I find that I can reach more of the area, using one tool and one insertion point as opposed to using a needle and poking the patient multiple times. I also find patients tend to bruise a little bit less with cannula depending on the size of the cannula you use and how you kind of manipulate the cannula through the tissue. Sometimes when you are using a thicker or a smaller gauge cannula, it can cause a little bit more trauma to the tissue and then in turn cause a little bit more bruising. But with this cannula, I find that it's really nice, small enough, and it doesn't tend to bruise all that often. So as you can see, I'm just kind of going in and filling in the area accordingly. I think between this eye and the other side, I used like maybe half a syringe of filler for both sides. So like 0.25 under one eye and 0.25 under the other eye, because again, I never want to do too much too quick. The under eye tends to pool a lot of fluid with the lymphatics alone. So putting a lot of volume in this area could potentially cause even more swelling and trapping of fluid. So you always want to do a little bit at a time. Right there, I put a little bit of arnica gel on a Q-tip and just kind of massaged over the area just to ensure that the filler was kind of massaged in, integrated into the tissue, wasn't lumpy, bumpy, felt good. That's kind of how I like to massage this area. I don't do a ton of manipulation because the product itself is so fluid-like that I don't want to kind of flatten it out and take away everything I just did. But I just like to run my Q-tip underneath, to ensure the product is kind of seamless throughout the entire area. Once I did that, I kind of noticed she still needed a little bit more. Her left side tends to be more deficient than her right. So I definitely did more on that side than on the right. And just kind of going in and touching it up. As you can see, the patient did a really nice job. She was super comfortable during the entire procedure. I did talk to her the following day, and then I saw her back for a 2-week follow-up. And she said the only bruising she had was right at the insertion site where I numbed her and went in with the needle. So thanks so much for watching, everyone. We hope you enjoyed this video, and we'll see you in our next one.